Hello, in this video we will discuss about the sinusitis. This is the sinuses infection, and what is the sinus we will discuss now. So the basically the sinus are present in the facial region. So here is the frontal region of the person, which that's contain a frontal sinus, maxillary sinus, and the ethmoid, and this is the lateral view, and this is the sphenoid sinus. So the function of the sinus is basically the possible role of sinuses which that contain space and may include the reducing the weight of the skull due to the space and the dampening pressure. So meaning the dampening pressure mean the decrease of the pressure and the humidifying mean the humid formation mean the moisturization and warming the inspired air. In this way the inspired air during the inhalation of the oxygen, so the air will be warm due to this, and the absorb heat and insulating the brain and aiding in sound resonance, providing the mechanical rigidity and increasing the olfactory surface area. So in this sinus will increase the surface area for the olfactory surface area. So anyhow, this is the healthy sinus and the sinusitis. So what is the difference? Let's begin to understand. This is the frontal, ethmoid, and sinus maxillary and nasal. So this is the basically the obstructed sinus opening and the sinus infection. So the obstructive sinus opening, in this way the overflow of the mucus will increase, while the healthy sinus contain are not a mucus. So here is you can see this is the frontal, ethmoid sinus and maxillary and nasal. So in this way you should need to understand the sinus infection will lead to increase the inflammation, lead to thickness of the wall of sinus, and this cause inflammation, and in this way the hyperplasia of mucus secreting cell will release the mucus more as compared to the as usual. So in this way the more mucus will cause the infection more due to the bacterial growth into the mucus. So anyhow, let's begin to understand on the cause, on the basis of causes. So the seasonal pollen will produce during the plant reproduction, and in this way the pollen allergy and the through pollen will be occur, and this pollen allergy will release the histamine through mast cell, will cause a bronchitis as well as this problem, the sinusitis. On the other hand, the common cold and medication, several medication will lead to cause the sinusitis, and the bacteria and streptococcus pneumonia and the Haemophilus influenza, which that will lead to also cause the sinusitis. A rhinovirus, influenza virus, and the para-influenza virus, including the allergies to mold and sometime pollen allergy and polyp formation, the growth of the polyp formation will lead to sinusitis also. A weak immune system form illness will cause also the sinusitis. So anyhow, this is the pathology if we will discuss. For example, so when the bacteria or fungi or virus will enter into the ciliated epithelium, which that is the layer of the sinus. So in this way, when infection of the ciliated epithelium will decrease the ciliary projection, and the cilia used for drain, and in this way the destroy mucus ciliated cell. When mucus will increase, so the cilia will damage, and in this way the impair the drainage from sinus. So on the other hand, here is the hyperplasia of mucus secreting cell will release also due to the infection to increase the mucus, but The mucus will increase, but it will not outtake because the cilia are not present, and the function of the cilia is basically used to expel this mucus. So when the cilia will not function due to the damage of the ciliated epithelium, decrease the cilia, and in this way the persistent of infection in mucus lead to edema and cause the sinusitis. And in this way here you can see the diagnosis, which that is we can check through endoscopy through ethmoid sinuses, for example. So this is the diagnosis for checking either sinusitis or not. And on the other hand, if we will discuss about the symptoms, so the symptom is many, because this is are present in the head region. So the headache will be occur, facial pain and pressure due to the increase of the fluid, the mucus, a runny nose and stuffy nose, mucus dripping down the throat and sore throat. When mucus dripping down the throat will move into the respiratory system also, cause the pneumonia. So in this way the cough and the bad breath is due to the infected mucus, which that is present when, so the mucus will increase the smell, will feel through inhalation exhalation of the air. So the severe and the chronic sinus infection will include the infection, growth in sinus nasal polyp. So the nasal polyp will be grow. The polyp means the outgrowth of the nasal sinuses, and the swelling the lining of sinuses. So the swelling the lining of sinuses will be occur, and difficult breathing, pain around your eyes, cheeks, nose or forehead. So this is a severe and chronic sinusitis, sinus infection. So if we will discuss about the treatment, so the treatment is basically the different type of treatment through drug or spray, nasal spray. So the saline spray serve several times for relief of the sinusitis, and the decongestant nasal spray also used. While on the other hand, the nasal corticosteroids will be used. Nasal corticosteroids used because it will lead to outflow of the mucus, and the anti-allergic medication because, for example, the histamine will produce the from mast cell will be inhibit, because the mast cell produce the mucus also, histamine also, sorry. So the OTC, the pain relievers such as the acetaminophen and the aspirin.